Welcome back in, Patient No Longer podcast, and today we've got a doctor in the house. I am joined today by Dr. Jon Roberts. Thanks for coming in, doctor.
Thanks for having me.
Well, it's always a pleasure to be with you, and you go back a long time. We've met at previous Picker Symposiums and earlier NRC Health events, and it's been great to see your journey. Dr. Jon Roberts is the Director of Pediatric Pulmonology at Driscoll Children's Hospital. Driscoll sees over 150,000 patients across their hospitals, clinics, and South Texas's first freestanding pediatric emergency room. You also direct the only cystic fibrosis center in South Texas, and pediatric care is very near and dear to you. It is near and dear to us as well. We have a lot of common interests and ideas, and of course, we do our pediatric collaborative every spring, where we bring in our pediatric clients, and it's great to have someone with that particular lens of healthcare on the podcast. So knowing that, and knowing that you care for children every day, I want to ask you this question and see how you answer it through that lens. What does human understanding mean to you, Dr. Roberts?
Sure. And thanks for having me here. I really appreciate this opportunity.
Of course.
Oh gosh, human understanding. I mean, to be human, right?
Sure.
I think that as human beings, we are one of the few social beings, social organisms in existence, and it's an important part of who we are as a species and as a culture. And I think that as human beings, maybe we've evolved this over time. Maybe it's always been there. I don't know, but we have this need for interaction with each other. Beyond just the normal, food, clothing, and shelter stuff. Like we have this emotional need as well. And I think that, especially more recently, over the past 50 years or so, there's been this push to really help try to understand who we are as human beings in lots of different fields and lots of different areas. So I think that human understanding to me is the ability for human beings to interact with each other, to listen to each other, to learn from each other, and ultimately, as it's implied, to understand each other, so that we can evolve even further in our own lifetimes, and that we can be, the best people that we can be.
Such a thoughtful answer. And as I was hearing you talk about, the social needs, I thought of Maslow's hierarchy, where our most basic needs are air, food, shelter, and then of course, social connections, feeling loved, feeling connected to our community, receiving great healthcare would all be up that mountain. I couldn't help but think of COVID and how that tumbled us back down the mountain, where air itself, we had COVID patients who didn't have air to breathe, and we were really reduced down to those basic needs. Now, we've been out of that forest for a bit. In your mind, have we recovered enough that we're remaking and mending those social connections that we lost during COVID? How are you seeing that play out in healthcare specifically?
Sure, I think so. And I think in some ways the experience has led us down different pathways that we were not on before the pandemic. And I think that, for example, the use of, podcasts like this, podcasts just exploded during the time of the pandemic, which I think is a great thing. And I think that, something that we can take into the future with us.
I should note maybe a disclaimer that this podcast began in 2021. So this was something that we too were thinking as we were disconnected in our own homes, our own offices. How do we come back together?
Even we have this ability to do these televideo meetings, which takes me back to, Star Trek days where you'd have a big monitor on the screen. Sorry, I don't mean to nerd out right there, but
beam me up.
Beam me up. A big screen, and we were talking to each other. We can really, truly do that. And I think that has made a huge difference in terms of the ability to have better participation in meetings. People don't have to rush during their 20-minute lunch time that they get in order to just get into a meeting. And I think it's really been great in terms of de-stressor as well. So I think that we've gotten some good things out of this pandemic. So I don't even though it did bring us down, and we can all remember that, sitting in our homes, not afraid to go outside, not knowing what to do,
Sure.
Having to really get to know our family members, which was great and not great at some points. And
It was mixed for different folks. Different
trying to get
families.
as much toilet paper as we can. I mean, we were really, I think, if you want to talk about hitting bottom, I think as a human race across the globe, I think we really hit bottom during that time. But I think it taught us a lot as well. And so I think some great things have come out of it. So I think we have recovered. You can see, you can go to malls, movies, everything again. So a lot of what we were doing before we can do as well. And in healthcare specifically, I have to say it was really interesting during the pandemic to do a televideo appointment with a patient and actually see them sitting in their home. I remember I had one patient with muscular dystrophy, wheelchair bound, he can't walk on his own. And he, in his electronic wheelchair, gave me a tour of his farm. And I saw some goats and cows and sheep and, all the dogs running around. And it was just amazing to see him in his home environment. And that is a perspective I did not have before that. It really changed the way that I looked at things. So I think, and those kind of visits, at least in the state where I live, we're still able to do them, and we still do them. And it's nice to be able to give that option to patients. But I will tell you that the loss of being able to examine patients and to be able to really get down to diagnostics and those kind of things was a big loss during that time. But we've recovered. We have all of that back now. Plus, we retain some of the things that we got out of that time period.
The seeing the tour and where your patient lives was a human side of them, a human element that you just wouldn't have seen through normal, clinical in your office.
Yeah.
Those four walls. So it's so fascinating, and you do such a great job of blending some really positive things that came out of it and some negative things too. What I also think is true, and I want to dig in on this on the digital side of connecting with patients, is through the NRC Health data, we're seeing a lot of consumers who say, wait a second, I like certain elements of telemedicine. Don't completely take it away. But I too realize, even though I'm not a doctor, that you can't do everything you need to do to care for me through a screen. And so we see a certain expectation, desire, maybe pressure from patients in our data that say, I want digital elements and I want physical elements. We have a faculty member of the Governance Institute, Ken Hughes, who's been on this podcast, who calls it physical and digital, or phygital, where I really want both. And I want to be able to have a journey that's curated for me where maybe physical makes sense here, but digital makes sense here. Or dare I say in healthcare, I could actually choose what works for me. So how do you feel about that approach? You've given this a lot of thought. I mean, do you think we can meld physical and digital, these phygital experiences together, or do we have a lot of work to do in that arena?
Well, I hope he trademarks that term. I think that's great, phygital. And with all the fidgeting, I remember the fidget spinners and everything.
Yes.
I think it's more relevant too. I think we do that. We definitely meld those things together. Even now, I think it's just naturally happened. It's not that we sat down in a room and said, hey, what's going to be our strategy moving forward? I think that a patient calls and says, I have a flat tire, which, by the way, every patient has a flat tire. I sometimes wonder why I don't see multiple flat tires on my way home from work every day, because that's the best of the excuses. But anyway, but now they can say, doctor, I really have a flat tire. I'm not lying to you. And can I do the visit virtually? And now I can tell them absolutely. I've told my staff that if a patient asks to be seen virtually, they don't have to ask my permission. The answer is always yes, because I'd rather have the visit that day. And if I really need to see them, bring them back the next day or the next week in person, than to lose that opportunity, especially when the patient may need us the most. So I think it's a great thing. And also, we have apps now that are connected into our hospital system. I mean, they've been around for a long time, but they have, the families can send us basically text messages they can send us videos and pictures of whatever. Like my patient's coughing, you want to hear it? I'll say, yeah, sure, send it to me, and they can. So I think it's a really great opportunity that we're living in right now to put these things together, the virtual and the in-person. I think that we still need the in-person element of this, because there are many times where I've examined a patient. For example, I always look in the kid's ears. I'm a pulmonologist, but I like to look in the kids' ears, their throat, and I have found objects in the ears they would not have known about. I've heard wheezing or signs of pneumonia that maybe we wouldn't have heard or known about if we hadn't seen them. So there's no substitute for the physical exam. And also just the body language is still better in person. So when the family comes in, especially if there's maybe problems at home or something else going on, you can get a much better sense of that in person than on video.
So you make a great point. And when we're talking about patient feedback, specifically how patients can call us or text us in the digital realm, there's also an element of that I want to make sure I ask you about, and that's reviews. So patient ratings and reviews of doctors. Now, our approach to this. We've been advocates of that. We think that's an important part of patient feedback. We also know that certain doctors don't feel that excited about it, don't always want to look at it, and don't value the feedback in the way that maybe the industry hopes or their patients hope.
Sure.
What's your take on this world of patient ratings and reviews?
When I first moved into my current position and got involved, with patient-centered care and patient reviews, I didn't know too much about it. And I did, in talking to some of my colleagues, like you said, there was a lot of pushback on patient reviews. For example, I had a partner, one of my associates, who would say, well, I don't really care what the patient says about me or thinks about me. I just care that I get them better. And I care that I give them good health care, good medications, and get them better. So I'm not there to be their friend. I'm not there to be, their family member, to be a shoulder to cry on. I'm paraphrasing a little, but
sure.
And that was really interesting to me, because I too, one of my goals is to give the best health care that I can to my patients, make them feel better, cure their problems, hopefully. But I think, and I've learned over the years, that what really, really keeps the patients happy and coming back is the interaction that we have with them and the positive interaction that we foster. Making sure that we practice active listening, that we use our empathy, and that we address all their concerns when they come up, instead of just ignoring them and saying that's somebody else's problem. So I think that the utility of ratings, so patient giving us numbered scores, and more importantly, giving us specific commentary, giving us specific comments on what they think of us, our staff, the process, the wait times, and all of that. I think it's so crucial and important in terms of making ourselves better at what we do. Because if a patient comes in to my office and is treated rudely by my front staff, and then they go through seeing the medical assistant, and they see the nurse, and finally they see the doctor, and we may have a great appointment, but they come out and they rate us lower because they had this horrible first taste in their mouth, this initial experience with the front staff. So I think that when we get a comment that says, I love the doctor, but the front staff was rude, that doesn't necessarily make me feel good.
Sure.
Yeah, sure, they loved their experience with me, which is great, but they had a poor experience in the beginning, and we don't want that. We want them to come into this clinic, which is very stressful to them. And I like to say this over and over again when I'm talking about patient reviews, that for the worker, the healthcare worker, so whether it be the nurse, the doctor, the respiratory or occupational therapist, or the front staff, whoever it is, like each patient that comes in is just another number to them. That's our inventory, right? So one patient comes in, next, and you keep going. Then we go home at the end of the day and we go back to our own lives, our own stresses, our own whatever. Right. But each patient that's coming through, maybe an extremely stressful and anxious situation, even if, we don't think so.
Right.
That baby who's been crying because they have pain in their ear for the last 2 days, nobody's had sleep, they're having fever, parents are really worried about them, and they come in and we just think, oh, it's just an ear infection. But to them, this is a really big event in that child's life. So I think it's important that we, as the healthcare worker, as the staff, think about that for every single patient that comes through. When we get feedback from the families, from the patients, it is so important to us that we think about that feedback and really let it sink in, because it's such what may be just another patient to us is, the most important thing in that patient's day or week or month for them.
So tell me about the video.
Sure. Well, I actually had this idea at this conference several years ago, when I saw one of the sessions had one of the hospitals, I guess, that was presented a video, and they presented a video of doctors reading their own comments, and they were all positive comments, and they would say, oh, Dr. So-and-so is amazing, they're great, I love this doctor, and you could see the doctor blushing and smiling, and I think the purpose of that was to kind of see what the effects of those comments have on even physicians,
Right.
physicians, right? So at that time, I had a seed planted in my head that, we also need to see the other side of things. Like, what happens when the doctor reads a negative comment? How does that affect them? I know, and not that I've received many, but when I have received a negative comment, it really hits hard.
Yeah.
I can have 99 positive, glowing comments, but the one I'm going to remember is that one negative comment that said, Dr. Roberts didn't seem like he was listening. And maybe I was off my game that day, whatever it might be. I don't have an excuse for it, but that's the one that's going to sit with me. So we had this idea, and over the next few years, we actually created our own video. It'll be the first in a series, actually. And I used myself as a guinea pig. And I remembered back to a time when I had, an interaction with a patient while they were in the hospital that was very stressful and high anxiety, both for the patient and for myself. And not to get into details about it, but decisions were made. The child ended up getting stable and getting better to a point, and then went home. And after they were released from the hospital, I learned that mother didn't want to see me anymore because it was such a stressful interaction. My opinion and her opinion differed while we were in the hospital, and that really hit me hard. I realized, that, or I should say, I didn't realize that mother felt that way at all. I really didn't know, and I feel like I'm a great reader of people.
Sure. It's part of your job.
I had no idea. And so, so she ended up seeing one of my partners for a while. And interestingly, when my partner ended up taking another job, she came back to me, and it was almost like nothing had ever happened. So, but that incident really stayed with me over the years. And I wanted to share that incident because, a lot of people look at us as, well, as physicians, as help my child, help my patient, help me. And we do want to do that as well, but sometimes, things don't go the way we want them to. And I wanted to just share that.
No, that's a great story. And it gets me to a question I want to make sure I ask you and the other doctors that we're talking to on this season. And that's about the role of the physician. It's been much debated. There's been a lot of discussion and burnt out physicians and what happened during COVID. And so we know some of that recent history, but I want to ask you about the future. As you look forward in the future, both for yourself and for physicians in this country, what do you see for the future of the doctor in America?
Whew.
I know it's a big one.
What a question.
It's a good question for a doctor, though, right?
It is a good question for a doctor. Well, I've always felt that, I tell my kids too, going into medicine, like, it's a pretty safe job to go into once you get past all the schooling and training and everything. Because unfortunately, people are always going to be getting sick and they're going to need medical attention. And there are different ways to give that medical attention. As we talked about before, you can do it in traditional in-person clinic visits. You can do it with now virtually online or on some kind of video platform. There are physicians, there are nurse practitioners and physician assistants or physician associates, and then nurses and other kind of therapists and everything. So there are a lot of ways to get medical attention. And I think with artificial intelligence playing a big role, we're certainly talking about a lot in our hospital.
Sure.
In terms of taking a lot of the grunt work away. So, for example, this conversation that we're having right now, if you were my patient, I was interviewing you,
Yeah.
and this artificial intelligence technology was, quote, listening to us. We finish our conversation, and I go to examine you, and while I'm doing that, there's a note that is being generated from our conversation that is, basically similar to what I may have written on my own. The technology is able to cut out certain small talks and other things and really concentrate on the important medical aspects. So I do think that we are moving into the future. I think we'll be able to improve our efficiencies. I really do not think that this is going to take the place of physical human physicians.
Right.
I think, I don't think we're going to come to that point where you can just talk to a robot and they'll give you medicine. There are certainly some things that may work for, I have ear pain, I have fever. It's probably an ear infection. Here's some antibiotics. That's going to work most of the time. But I do think that not only the ability to do a physical exam, but also the ability for us as practitioners, whether it's a physician or some other practitioner, to be able to explain what's going on in a more human way.
Right.
Getting back to the humanistic part, but in a more human way so that the patient understands at their level. One of the things that we have to be good at and is to know your audience, to recognize, am I talking to, a seasoned professional person or somebody who's not so much? Am I talking to a 17-year-old child or a 5-year-old?
Right.
We have to be
Makes a
able
big
to,
difference.
even the 5-year-old, we have to be able to explain to the 5-year-old what's happening to them in ways that they will understand. So certainly I think being human is what being a physician is all about.
Very well said. And that was a big existential question. So I'm going to hit you with something far different in our speed round. We're doing a new speed round. I didn't tell you this, but these are quick questions, and we're just comparing the results, doing a little bit of research. That's the R in NRC Health.
Like Family Feud or?
Sure, but it's just there's no right answer, and I'm just going to hit you with a couple quick ones,
Okay.
mostly either or choices. So, dogs or cats?
Cats.
Beach or mountains?
Beach.
Morning person or are you a night person?
Both.
Okay, nice. Favorite TV show of all time?
Cheers.
Excellent. And San Diego or LA?
San Diego. Okay.
Very well said. I want to ask you one more question about pediatrics before I move to the question I always close with. You're in pediatrics. You're in such an important part of healthcare that's important to us. We have the Pediatric Collaborative. I think sometimes people don't realize how important pediatrics is until they have a child who needs care.
Yeah.
And we recently asked a question in our survey, which we shared at the most recent collaborative. I had a workshop with Toya Gorley, my colleague, and we debated this with that group. And I want to bring it to the podcast because the expectations among parents for pediatric hospitals, 55% of consumers nationally said, I expect even more out of pediatric hospitals in terms of quality, safety, the excellence of the experience than I do a typical hospital. And by the way, my expectations of a typical hospital are really high, but they're even higher for the majority for pediatrics. How does that strike you? Do you look at that as a higher bar and it's exciting to try to hit that? Do you look at that as unfair, that the expectations are even higher? How does that strike?
Well, first of all, I get it.
Yeah.
Because I think that when it comes to our children, when it comes to my children, I will do anything on this planet for them. And so I think that if you collectively think about that, all the parents across the whole country with children who are in need, when our kids are in need, we suffer with them. So I think that we hold pediatric care, maybe we always have. My grandfather was a pediatrician, I think in his time too, to some sort of a higher standard, because we're dealing with part of the population that's so vulnerable.
There's a shared suffering between the parent and child.
Yeah.
It's such a different kind of patient experience.
Yeah, so if you go through a pediatric hospital and you go from room to room, you're not just going to see patients in beds. You're going to see patients in beds with family members in their little chair next
By
to
their
them,
side.
who aren't sleeping well, who are just going through this with their child. So I do get that. And I think that, I would just say, if they're going to hold us to a higher standard, I'd say bring it on, because
Yeah.
I think that we need to be at that higher standard.
Right.
If someone's saying do better, it doesn't mean that they're wrong.
Right.
It just means that we need to do better.
Yeah. And answer that call.
Yeah, and answer that call. So I think that, we should never, ever stop trying to get a higher standard than the one we have now, because we can always improve and always get better.
I always end with this question. Obviously, we've had a great partnership and you've been in medicine for some time, but let's say you get in an elevator back in Texas and you've got someone who comes in with you, short elevator ride, and it's their first day in healthcare. Day one, what's a piece of advice you would give them on that elevator ride?
My advice would be listen to the patient. Listen to your patient. I don't care what you do, if you are whatever level you're at, whatever perspective you have, whatever interactions that you're going to have with that patient, make sure you listen to them, but really listen. We talk about active listening, and that's just a term, and people roll their eyes. Oh, active listening, like that just sounds so fluffy or whatever. But active listening is you stop the conversation that's going on in your own head, which we always have something, right?
Right.
You look the patient or the person in the eyes, and you just open yourself to whatever they're saying. And I think that if more of us could do that, we'd be much better for it, much better planet.
I would completely agree. That goes beyond healthcare. And it's been a pleasure listening to you today, Doctor.
Thank you.
Thanks for coming on to Patient No Longer, the podcast, and we'll talk to you again soon.
Excellent. Great. It was a great experience. Thanks.
Wonderful.